Welcome back to KTN News Center. Time to have that important discussion about marburg outbreak in Tanzania, with the Kenyan government through the Ministry of Health being on high alert. But before we get into that conversation with the Daktari here in studio, Dr. Gishui Kariuki, let's have a breakdown for you about about the fears of a marburg, where the country is still on high alert following the outbreak of suspected cases of marburg virus in the neighboring Tanzania. So the Ministry of Health has directed all county health officials to be vigilant, identify and isolate any suspected cases of the deadly marburg virus to facilitate timely management of the highly infectious disease. So at least 5 people out of the 8 suspected cases have died in Tanzania, raising fears that the virus could find its way to Kenya. Members of the public have been asked to report any suspected case, especially for people with a travel history to Tanzania. Gloria Milimo reports.
Uchunguzi ambao tumeufanya katika maabara yetu ya taifa ya afya ya jamii, National Public Health Laboratory, umethibitisha uwepo wa virusi vya marburg ambavyo vinasababisha ugonjwa unaojulikana kama marburg viral disease.
The confirmation of the highly fatal zoonotic hemorrhagic disease in Tanzania now puts countries on high alert following the nature of the infectious disease. To prevent the disease from penetrating the country's borders, the government, through the Ministry of Health, has now put its county bosses on alert, calling for vigilance to facilitate quick response should the virus find its way to Kenya. Through a new statement sent to newsrooms, the Ministry of Health has also called on members of the public to report any cases of unusual high fevers among those with a travel history to the affected country. Similarly, virus experts advise the need to sensitize community members on infection prevention measures to avert a catastrophe should the country confirm a case.
Since it is very close to us, just the way Ebola was close to us during the Ebola outbreak in Uganda, we must actually work very, very quickly to ensure that the same measures that we had put together in terms of borderly screening and ensuring communities are advised on what to look for and they can report, these measures should actually be put in place immediately.
Marburg virus disease, said to be in the same family as Ebola, that has a fatality ratio of up to 88%, is transmitted to people from fruit bats and spreads through direct contact with bodily fluids of infected people.
It presents with high fever. It also presents with a severe headache. It also presents with malaise. Somebody feels fatigue. Some individuals might have a rash. And then there is also an element towards the end where individuals might present with internal bleeding.
Kenya is leveraging on lessons learned from COVID-19 pandemic, its robust surveillance system and trained healthcare workers to handle the situation should the disease penetrate the country's borders.
The marburg virus was actually identified in 1967, is not too long ago. So closely, I think in the 70s or 80s, there have been 2 outbreaks. A number of these patients actually died. And usually what happens, the disease actually just dissipates. A number of them actually died. And all these outbreaks actually started within the western region of Kenya. And that's why we say we definitely have a reservoir on that side for marburg. So we actually need to be very vigilant in terms of ensuring that we keep our surveillance system very, very clearly in that part of the country.
Kenya has also activated the Emergency Operating Center and the National Public Health Laboratory and the Kenya Medical Research Institute to deal with any eventuality.
We are beginning to get very frequently outbreak of Ebola, outbreaks of infectious diseases. Not too long ago, in February, there was an outbreak of Ebola in Guinea, Equatorial Guinea. So the whole point is that we should not really wait anymore.
5 out of the 8 confirmed cases in Tanzania, including a healthcare worker, have died, as 161 more identified contacts are currently being monitored. Currently, there are no vaccines or antiviral treatments approved to treat the virus. Gloria Milimo, KTN News.
Thank you, Gloria Milimo, for that report, setting the stage for us to have this discussion with Dr. Gishuhi Kariuki. Daktari, good morning.
Good morning to you, Brenda.
Kindly make us understand, what is Marburg virus?
Marburg virus is a virus that is in the same family as the Ebola virus. It's a flavivirus. It's an RNA type structured virus, and it is relatively highly contagious. It is infected. Essentially, it's a virus that usually lives, or the reservoir host is bats, fruit bats, but it also infects primates. And it can be transmitted from person to person by any bodily fluid. That means saliva, that means from fecal oral transmission, sweat, breast milk, semen, and during sexual intercourse. So the thing about this virus is that it attacks the system that's supposed to protect the body, so that's the immune system. And once it attacks that, the immune just goes on hyperdrive, and that's where you get all those symptoms, because the immune system carries those viruses to all parts of the body. So you get the headaches because the brain and the nervous system is affected. You get conditions that affect the kidneys. You get the diarrhea and the stomach symptoms, or stomach upset symptoms. And because the immune system is the one that is the focus of this virus, it also causes the other effects of a normal viral infection. So the symptoms initially will start with symptoms that we are very familiar with, like malaria. It looks like malaria in the beginning: a high fever, you have a headache, you have muscle aches, you feel fatigue. Then after the second week, that's when you start having the serious signs of diarrhea, vomiting, and then a rash usually may occur. And then after the second to the third week, that's when you have these hemorrhagic symptoms, where people bleed internally, or, for example, from a puncture site, or they bleed uncontrollably. And after the third week, and usually the mortality happens between the second and the third week.
The second and the third week.
Yes.
So you've told us where this virus comes from. So does it mean a primary contact might be someone who's eaten what you've mentioned?
Okay, yes. Traditionally, what we understood from Ebola and Marburg virus is that it had to be like people who eat bat meat, or bush animals, or people who ate primates, for example. But that is not necessarily true. What we have come to discover is that while those animals tend to be what you call the reservoir host, where the virus tends to prefer to stay, there are vector hosts, meaning a vector host is a host with which the virus uses to move from one reservoir host to another. This happens to be primates and us, human beings. And we also recently found out that actually pigs can also be very serious reservoirs. And this should make us aware that we should not only consider it a thing for the bat or for the bush animals, but even animals that we keep at home. So,
right. So you're saying the transmission is more similar to transmission of Ebola, even COVID-19. But one would ask, how can it be sexually transmitted?
So it is within any fluid that we have, bodily fluids. So that includes saliva, vaginal secretions. So all these are places where the virus can use to move from one person to another. That's why you find that initially, like with Ebola, we used to hear it's people who are handling people who had died. But that's just by virtue of they were the ones who are coming into contact with all the bodily fluids. But now we know with Marburg, especially Marburg and like Ebola, sexual transmission is a very huge aspect of it, because this virus hides itself in places where the immune system doesn't go. Like we just said, it's an immune system virus, right?
Yeah.
So some places where the immune system doesn't really affect are like the brain, the eyes, the cornea, for example, and the testicles. So now when the virus hides itself there, even if the person heals, after the 3 weeks, they survive the viral attack, right, they can still spread it.
All right.
Despite not having any symptoms themselves to their sexual partners. That's why you find that somebody who has had Marburg virus before and has been cured, they require about 12 months of not having unprotected sex. Otherwise, there's a risk of spreading it.
All right. So what's the treatment?
Well, currently, unfortunately, we do not have any treatments that we can say conclusively work. Like, we do not have any antivirals that fight Marburg virus. We don't have any, for example, vaccines that are targeting Marburg virus. We have a lot of things that are in the pipeline, and we have some things that have been shown to potentially help, like the vaccine that was used for Ebola virus is being used is being given to patients to see if it has any effect. There's some promise there, but conclusively we do not have anything that has been shown to work. What we usually do is give the patient the supportive treatment to keep them alive over that period of 2 to 3 weeks. Once that is done, the body the reconvalescence happens and the person can survive it. So
all right.
Supportive therapy is the mainstay of treatment.
All right. And when you talk about vaccine, because it's good you've mentioned even the Ebola vaccine, but are there vaccines that can be given, like you take it as a way of trying to prevent high risks? Because we have like the COVID-19 vaccine, we have the rotavirus vaccine, we have the flu vaccine, malaria vaccine. So are we likely to, do we have a vaccine that someone can take?
Okay, so right now, there's some vaccines that have been allowed, and I say this allowed in the sense that once you are in such a problem where you don't have a fix, sometimes just attempting or trying to fix it is better than doing nothing. So there's some vaccines that are being used in what you call compassionate use. There are two vaccines that have been allowed for this, and they're being given, and they have been shown, they're showing some promise, but their efficacy has not been properly investigated. So we can be using them for compassionate use, but cannot give them to the public saying that this is
a vaccine for Marburg.
No.
So if someone gets Marburg, because transmission it can be transmitted easily.
Yes.
So do we start this whole process of isolation centers? And if that is the case, do you think the country is ready to handle this?
Well, I can say we are probably in a better position to handle it than before because of the COVID-19, the lessons that we learned from it, from the COVID-19 pandemic. But without targeted surveillance, I mean active surveillance, properly looking for the cases and their contacts, and making sure that our borders are safe, we are not properly prepared for this. Because one, we haven't gone properly into the community awareness and public awareness campaigns, because those are the frontliners as to how you limit this. And then the creation of isolation sites is probably not in place right now. And the worst thing about this virus when it comes to susceptibility, the people who are at highest risk are healthcare workers, because they're the ones who come in contact with somebody with a severe headache, not knowing that that could be a person who actually has Marburg virus.
So apart from the health workers being at a high risk, which other age group are at a high risk? And also, as you break it down for us, also talk to us about children when it comes to the Marburg virus.
Okay, so the Marburg virus, like with the Ebola virus, is not very picky. It'll take any host that it can get. The people who are unfortunately at a higher risk are pregnant women, for example, because the immune system is generally lower. And people who work in areas where this virus considers safe, so people who like wardens and people who work in forest areas. And as well as when it comes to demographically, it is people who are more exposed to handling, for example, meat and animals that may have come into contact with this virus. But generally, it is very non-discriminatory.
It's non-discriminatory. Yeah. So when we get, if God forbid, we're praying that it doesn't get into the country, but in terms of disposing of bodies, you know,
yes,
of people who've died due to Marburg, how should it be done?
It should be done, the one huge aspect of it we learned from the first time we saw in Ebola is that we have to do it conscientiously. you cannot, attempting to force the communities that have different burial rites to do things by force doesn't work. What eventually happens is that they hide their people. They hide their dead because they respect their cultures. It's more about education and explaining to them so that they accept these measures. So that is very important. Public education, and of course when you have those sites where they do have outbreaks, for example, should it happen, public healthcare workers really have to come in place and try and protect these communities. And yes, so those are the measures that would need to be taken by the MOH and any public healthcare workers.
So, and someone would ask, just like COVID-19, people are being advised to have a healthy diet, ensure you eat lots of fruits, vegetables. So, should someone get Marburg virus, what sort of meal should you be having? Okay, so obviously, unfortunately for Marburg virus, unlike COVID-19, it has that element or aspect of the diarrhea and the vomiting. So probably the diet won't really change much. So it's more of the fluids? Yes, the fluids will supportive therapy is what you need to make sure that that person, because of the vomiting and the diarrhea, they don't die of that. The hemorrhagic fever does happen, and you can do some supplementation of like blood components, give them some platelets, give them some blood. But if the structures in the healthcare system cannot support them, then we will have a problem. We'll have a huge problem, because the supportive care is literally everything. As we have seen, like for example, the cases of mortality in African countries which don't have robust healthcare systems, they're much higher. When somebody from a developed country gets this virus, you like for example in the US, they had a few outbreaks back, an outbreak some time back, and some victims, but they did not have any mortality. While here in DRC we have a mortality rate that, like Uganda in 2017 was 100%. But in some countries, like in Europe, you find it at 24%. Why? Because they have robust systems. All right. If you give this person the right fluids, blood supplements, they have a higher chance of surviving. All right. So it's that creation of robust systems that will actually get us. All right. And it's good you're saying that there's need for public awareness, in terms of members of, members of the public getting to understand what this Marburg virus is. That is what we're doing right now. Even as we wind up, Dr. in a minute, so you're saying some of the signs and symptoms, the telltale signs include fever, more of like malaria, but someone will be like, okay, I didn't travel to Tanzania, I have weak joints, body aches here and there, a high fever. Someone will not be too quick to run to the doctor and get tested. The first thing you do is to run to a chemist and get, subscribe your own treatment. Yes, but that, you see, that is a huge aspect of why public education it has to play a huge role. Because if somebody runs to the chemist and gets the paracetamol and goes back home and vomits next to their family, those are immediate contacts. So public education is absolute key. And you have to remember, with urbanization, traditional aspects of saying that I did not go to Tanzania is not necessarily protective, because somebody who traveled from Tanzania, or even somebody who was in Uganda through Tanzania, might be your contact. So this is where public education becomes very important. If you have those symptoms, you need to be very aware that this can happen to you. Don't run to the chemist, rather run to a health facility and say, this is happening to me, and I have heard about this. All right. Can I get myself checked out? All right, thank you so much, Dr. Geshuhe Kariuki, for making us understand. I've also understood very well what Marburg virus is, how it can be spread, and sort of the sort of safety precaution measures that we need to take. If I'm not wrong, even wearing a mask will really help. Yes, wearing masks, washing hands repeatedly, hand washing, those are the first and the most key things. It's more like just like the COVID measures that we were taking. Thank you so much, Dr. for joining us here on KTN News.